Thank you, Professor Zimlichen, and please stay with us on stage for our first panel today, which is about the hospital of the future. Populations around the world are getting older, and technological advances are changing the way healthcare is delivered. Hospitals already made a digital leap forward as a result of the COVID-19 pandemic, but what will patient care look like over the coming decade and even further down the line? Will we undergo digital triage before even turning up at a hospital? Will robots replace surgeons? And what will the patient experience look like? With us to discuss this fascinating topic is Professor Ze'ev Rothstein, who you just heard from, and Professor Ran Balitzer, Chief Innovation Officer for Clalit, Israel's largest HMO, covering over half the country's population. He also serves as founding director of the Clalit Research Institute and is a member of the WHO. Thank you. Collaborating Center on Non-Communicable Disease Research, Prevention, and Control. And of course, Professor Zimlichen, please join us. I have some important questions for you. Thank you, gentlemen. Thank you for being with us. I'm very excited for this talk. First question for you, Professor Rothstein. Can you look into your crystal ball and tell us what will hospitals look like in a decade from now?
So symbolic you asked me this question, and next to me is Ran Balitzer from the community side of the healthcare system, and Eyal, the representative of the Israeli medical institution hospitals, as we used to call them in the past. And the combination of the two is going to be the dominant, issue in the future. We listened to the magnificent lecture of Eyal, understanding it comes from hospital. And you see how hospitals in the future are going to be downsized, shrink, and much more. Activity will be taken at the patient home or in the community next to the patient, and out of hospitals. And the issue is not just economic. Is the ability, is the technology that permits us even to monitor better the patient at home than he is in internal traditional department in the hospital. So I don't have to use guesses. It's quite real, and we are on the way to there, and we are going to hear, from my good friends here on the stage, some of their ideas, how they evolve to the modern, I would say, new healthcare system that is all about just to emerge.
Thank you so much. Professor Zimlichen, one of the problems faced by smart hospitals is alert fatigue. Doctors are being overwhelmed by the sheer abundance of electronic nudges and notifications coming from their medical equipment. Tell us more about the methods that you're developing in order to improve quality, safety, and efficiency without disrupting and disturbing medical staff.
Thank you. So, as you're saying, it's a very important topic. We're used to coming into a medical environment and hear alarms everywhere. We're used to seeing doctors and nurses respond to alerts popping up on the screen, sometimes one on top of the other, and what we're seeing many times are clinicians just closing that notice without even reading it, which of course is a huge, huge problem. I think that artificial intelligence will play a major role in lowering alert fatigue. We've been working for a couple of years now with artificial intelligence, for example, on reducing medication errors. We're seeing that the artificial intelligence is able to much more efficiently and effectively alert for what really needs to be alerted for, and not something that the clinician would read, maybe waste 30 seconds and then decide is not relevant, wasting, of course, his time. And then, of course, he would be much less likely later to respond to another alert popping up. So AI will definitely be a critical element in reducing false alerts and allowing us only to pop up alerts that are critical. On top of that, the next generation, and this is something we're starting to see, would be artificial intelligence that takes responsibility on also responding, so closing the loop. If we can do that, if we can close the loop with alerting and responding, we will take down considerably the burden on clinicians. And of course, today, in this day and age, and especially with COVID, as I mentioned before, this is critical to making sure we're able to provide better care.
Thank you for your response. Next question for Professor Belitzer. Can you tell us a bit about your efforts at Clalit to use health data to create predictive models? Are we really going to see hospitals call people in based on predictive data before, for example, a heart attack actually occurs?
So, the classic approach of healthcare has always been reactive in nature. People go to the hospital when something is painful, when there's pain, when there's discomfort, when there's disutility. But in an era of chronic diseases, this is too little too late. When people already feel those symptoms and signs, the pathological process is already so entrenched that there's very little you can do to actually avert some of the negative outcomes of that condition. So you've asked this question in a future tense, will we in the future? And I will say that this is already a matter of the present and even of the past. At Clalit, for the past 12 years, we have been actively involved in transforming the paradigm from reactive care to predictive, proactive, and preventive in nature. We've been using the wealth of data that we have to create practical predictive models that identify patients ahead of time, sometimes years before the deterioration takes place, and sometimes days before it does, depends if we're talking about acute or chronic condition, and alerting the patient through their physician in time in order to change the course of the way. To give a few examples, we do this with many chronic diseases. We do this with cardiovascular disease, with renal disease, even with infectious diseases. And we amalgamate different types of data to make this happen. We use the clinical records. We have at Clalit a unique resource of over 20 years of electronic medical records from the community and from the hospital setting amalgamated at once. And we use a combination of all of this data, and more recently, also data coming out of unstructured sources, from medical imaging and from other unstructured sources. And all of this goes into a predictive model that tells us which of our patients is going to deteriorate. What we've been involved in the last 2 years is creating a new platform which takes care of some of the problems that Eyal have just mentioned, of the fatigue and the difficulty of putting it into the daily practice. And with the combined work of the IT division and the medical division and the innovation at Clalit, we've created a platform that takes all of the different predictive models, puts all of them into the clinical context, and when the physician, the family physicians, goes in the morning to their clinic and opens the computer, he sees from all of his 2,000 patients, 10 people that he needs to take care of today proactively to prevent diseases and the deterioration of tomorrow. And of those 10, he can actually see which diseases and which instances he needs to take care of today, what he needs to do in terms of an algorithm, and with a very quick batch of orders, make it into practice. And all of this so he can cover, within the 2 hours that we actually pay him to do, he can cover dozens of patients in a proactive approach. So this is not a theoretical construct. This is our daily practice at Clalit, and as we go along, we continue to create new platforms to be doing that.
Very exciting. What will the physician, this is a question for you, Professor Zimlichman, what will the physician of the future working in a smart hospital look like? And how should smart hospitals use AI, smart devices, and robotics to help doctors be more effective rather than taking away their autonomy?
Well, another very important issue, and of course something that resonates a lot because of its importance in the future of what we see, both professionals and the future of healthcare. One of the things we're going to be seeing is the physician's role shift. We're already starting to see that happen. I can give you one example. We are building now a new profession at Sheba. A profession, we call it the medalist. Medalist stands for medical analyst. This is a profession that we think will need about 4 years education in the future. We're building that education process that will work shoulder to shoulder with the doctor, will actually be there on the floor with the doctor when he's seeing his patients, and will bring the data needed to make better decisions. By the way, we're doing this together with the Israeli Intelligence Corps, because the Intelligence Corps have been doing this for many, many years. They're trying to make better decision-making for commanders in the army. We're trying to make better decision-making for clinicians in the future. They are already working right now at Sheba. We're doing a pilot in a couple of departments, and we're building the software that will allow them to dig deeper in real time and learn from data from within our own medical records, looking at the 20 years of data that we have, but also outside into new science and publications and whatever we can learn to impact our decision-making right now. So this is an example of what we'll see changing in the future. I will say one thing about medical doctors. The medical doctor of the future will need to use artificial intelligence to improve his decisions. That is important. It will not replace the doctor. It will improve his decisions. This is what we're going to be seeing over the next 20, 30, 40 years. Beyond that, if we try to think further out, artificial intelligence will replace a couple of the things that the doctors are doing today. It will require the doctors to become much more humane in the future. So if we're thinking about being optimistic, what will happen to the medical profession? The medical profession will have to become more humane in the future, because that will be the only thing that differentiates the doctors from the machine. Because otherwise the machines will be much better than us in almost anything. But in humanity, this is the one thing that will always have an edge. So maybe that would give us a little point of optimism to think about the doctor of the future as being more humane. I hope that this is indeed what happens.
We look forward to it. Professor Balitzer, AI diagnostics is evolving rapidly. How is this going to change the role of hospital clinicians specifically?
So I will try to give a few more points beyond what Eyal just mentioned. Eyal mentioned in one of the slides, he mentioned physician burnout. This is a huge problem globally, and COVID didn't make things better in that sense. And we need to think about what is it that makes this profession so difficult mentally on a daily basis, that takes the best of society and drives them out of this profession. And I think some of it, at least, has to do with the content of our daily chores. And the good news is that AI has the capacity to take away much of the repetitive daily work of physicians that do not necessarily need to be done by someone who has learned 7 years to get his medical degree and then 5 more years to get their next level of education, and so on and so forth. It doesn't make sense that there's so much repetitive work. If a computer can do some of this better than the physician, then they should. Not only as an augmentation of decision-making, as was mentioned, but actually taking away some of the repetitive, bureaucratic aspect of our work. This will take away from the physician the more problematic parts of the daily job, and hopefully not only make our job more humane and somehow increase the association and the daily connection between the patient and the physician, but also bring the profession back to its glory in the sense of making serious decision-making, making decisions together with the patient. And so this brings the classic element of practice that we somehow lost as our profession became more and more technical. So I see AI taking over some of these repetitive tasks. Some professions are going to be modified more than others and more quickly. Pathologists, radiologists, these are the professions that are going to be first moving from a very technical aspect of looking at images and trying to see little points in there when they're very tired. And this is like, I don't know, the 11th time that they need to do it in the past 10 minutes. This will go away. Today, AI and computers have better imaging capacity than any human being for that sense. This is the first to be transformed, and that aspect of the work will go away, and what will be left is the more invasive and the more, let's say, intelligent component of this profession. It will change. It will definitely change. Hopefully, some other aspects will change. The pharmacist role will change, but that is a matter for another discussion.
And our last question is for you, Professor Goldstein. In just a few sentences, as a former hospital director with enormous experience, having run 2 of Israel's largest hospitals, how will hospitals have to transform their business models to meet accelerated changes in technology?
You know, we are concentrated today in a lot of newest technology. I want to stress out that one important feature of hospital and medicine is the human contact. And the human contact of the physician and nurses are going to stay and prevail despite all the technology that's actually embraced them. I do see the future, you know, of the healthcare system as a cloud of big data that will do the immediate search for the physician or the caregiver and find out what is the best way to conduct diagnostics or to make the right decision about the patient based on the information that has been collected. And this information is precious It's extremely important because you don't have to think, you don't have to go back, you got it in front of yourself, and I do see many AIs solutions that you can look at it as a plug-in, I would say, solution that is next to you. So even a remote physician in the desert or somewhere else in a rural area will be able to act as specialist using the AI, I would say, facility that will gear him to the right solution, right medication. And we already see young companies, AI companies, that are suggesting, I would say, improving the medical process by working together with the caregiver, even in the remote places. And, you know, in my imagination, the tomorrow family practitioner will be able to act like an endocrinology specialist in diabetes, and if this patient will be at the best type of treatment and monitored, and so on and forth for the other, I would say, solution like fertility and other, I would say, issues that today are being dealing by specialists. We shouldn't forget the human contact. We shouldn't forget the humanity, as Eyal just mentioned. This is going to be part of us. Hospital will be limited to intensive care with a lot of technology, a lot of options. Life will be much longer, and we shouldn't ignore the importance of the big data and AIs in the prevention, I would say, phase, because it's much easier to prevent a disease than to take care and to cure a disease that already is there. So the combination of the community, I would say, setups with the stringed hospital, but high-intensity hospital, and with the human touch of the caregivers is the future hospital. And I base myself not only on years in the healthcare sector, but, you know, I'm so happy to be in this transformation era when we do transform a lot of manual, I would say, activity into intelligent one using the facilities that the technology is given to us. I can imagine tomorrow, and maybe even today, patient who needs operation that usually is being done in hospital, but right after the operation, they are back home and fully monitored, okay, at home, and with much better surveillance that they can allow them to be in a hospital, in a department of 42 patients and 1 nurse that is taking care for them. So this is already here, and we have to really to develop it to the utmost.
Thank you so much to everyone on the panel, gentlemen. That was extremely fascinating.
Thank you.